I move cargo all over the world.
That's great.
I worked for a freight forwarder, and I move cargo all over the world. As a matter of fact, I'm gonna be maybe. I have a job offer with a French company now.
Cool.
Yeah. So yeah. So let's see what happens. I might take it. I might not. But I that's pretty much what I do. He started doing a wrestling podcast. WWE. I'm not sure if you know what WWE is.
It's wrestling.
Right. So I'm a fan. He's a fan. He started doing one, and when you look at it, WWE is scripted. It's scripted sports. We watch it, we entertain it, fine. So he started doing it, and I was talking to him one day about it, and I'm like, hey, your show's good, but you need something else. So he's like, well, you want to come on the show? I was like, yeah, sure. You know what? I'll go on. He got me on. He got another friend of ours on. So we started doing the HHW show, the Hard Hitting Wrestling Show.
Yes.
And that's how I got started. I was just a guest on his show. I was a regular guest. Now I just became one of the co-hosts of the show. And then when we went through our election process out here, back in November, where Donald Trump is no longer, lost the presidency,
Yes.
and Biden took over. This country was already divided, but really got more divided because people started saying that the elections were rigged, that they were falsified.
Yes.
And I went on a rampage on my Facebook page, pretty much just telling people, look, believe in the system. Donald Trump did his time for 4 years. The people didn't like him. The people voted him out. You know what? Just like when President Trump took over in 2016, nobody gave him a chance. Why are you being like those same individuals that didn't give Donald Trump a chance? You complain about those individuals, and now you're being those people. Why? And I got a lot of feedback from it. I got a lot of people liking it. I got a lot of people hating it. Went back and forth. And I had a friend of mine, a childhood friend of mine from like the 6th grade. I've known him since I've been 12 years old. Him and I started going back and forth. And he realized, he's like, hey, wait a minute. You do podcasts. He's like, I have a microphone.
Yes.
And I have a camera. I want to talk. So I gave him a call, and I'm like, hey, so what do you want to do? No, this is what I want to talk about. I was like, okay, let's do it. I'll get together with the guy that does the wrestling show. He goes through a media company. So I got together with Clovercrest Media Group.
Yes.
And they, and we got together and we started talking about it. And he was like, all right, good idea. Let's do it. And that's how we got together. I pay him a small fee of, I think it's like $50 a month.
Yeah.
And he produces my show, does all the content, does everything for it. I took the vaccine.
Yeah. It's like safe. Most of the vaccines are safe, but sometimes there can be certain reactions occurring. And it depends on the country the vaccine was manufactured, because the variants change from country to country. So
right.
Yeah.
Right. That's definitely. Like I said, I took the vaccine. I took it. Why? I'm older.
Yeah.
I have those underlying conditions where if I do get it, can I die? Possibly, maybe. Can I get really, really sick? Yeah. And I didn't want to take a chance. We have here 3 vaccines. We have the Johnson & Johnson.
Yes.
We have Moderna, and we have the Pfizer.
Yeah, we have Pfizer and AstraZeneca, I think.
Right, and then the Johnson & Johnson came out, which is only one shot.
Yeah.
Pfizer and Moderna are 2 shots.
Yes.
So when the Johnson vaccine came out, I was like, all right, Johnson and Johnson, they're reputable, they're reputable company, so they're worthy, Moderna also, but so is Pfizer. But then you started seeing the news media where it started causing blood clots.
Yes.
I think we had maybe 1 or 2 deaths over it. And I was like, okay, you know what? No. Boop. Moderna, my wife took the Moderna.
Yes.
She had a little bit of a side effect, after she took it. I was like, okay, don't want that one. And then I was like, all right, well, Pfizer makes Viagra. They make a bunch of other pills, which are pills that I've always worked that are good, not good for you because I don't think pills are good for you anyways, but just good for you in general, that they have a good track record. So I was like, all right, I'm doing the Pfizer. I took my first shot. All I had was a little bit of soreness in my arm. Took my second shot. All I had was soreness. I did not get no symptoms of anything.
Yes.
I felt fine.
Yes.
No issues. So to me, it was take it, because if I get really, really sick, can I die? Yes. So I chose to take it for that reason.
Okay.
I mean, do we isolate ourselves out here? Pretty much. We don't go many places, but you see now, when in our case out here in the United States, we have right now, I want to say about 50% of the population vaccinated.
Yeah. Okay.
So after spending a year of everything being closed up, everything's starting to open up again.
Do you know anybody who has had COVID-19?
Yes.
Yeah. Okay. Then
I know several people that have had COVID-19. My mom had it. My sister had it. I had a coworker that had it. I had some other friends that have had it. I know about a total of, I want to say almost 10 people that have had it.
Okay, that's a good reason to take the vaccine, because some people do not have any family members who have got the disease, and they're doubting it. Like people like me. I'm really thankful that none of my family members are being affected, or friends. So,
well, you know what you have to look at. Okay, you guys haven't gotten it. All right. What's the reason for you guys not getting COVID? Are you socially distancing? Are you actually not going anywhere? Are you very isolated? You know what I'm saying?
yes.
So whoever's isolated, really is not going to get it.
Yeah.
Because like I said, we pretty much were very well isolated here. All we did was go to work, come home, go to work, come home, go to the grocery store, come home. And it was one of those where we'll get home. All right, hand sanitizer, sanitize yourself before you come in. Every Clorox wipes everything, so we did all that. We did the social distancing. You're at the grocery store, you're in the line, you know what? Why I'm here, the other person's all the way up there. We didn't get that close contact with people either. The only time where we could have gotten it, and it's weird because we did not, was when my mom got COVID. My mom got it. We were in the car with my mother for about a good 5 hours. The next day, she's like, I got COVID. We quarantined ourselves just in case.
Yeah.
We took the tests, negative every single time.
Okay.
So we came to the conclusion, and not because we've been tested or whatnot or the other, but that we might have gotten COVID in the very beginning stages. Why? My grandson had all the symptoms of COVID before it made it public out here, before it became COVID, I guess.
Yeah.
I think out here we were diagnosed with COVID in March of 2020. So my grandson had the had all the symptoms in February, I want to say.
Yeah.
So maybe we got it then and we just were asymptomatic and we didn't get symptoms,
Yes.
but I've been around people that had COVID and I never got it. So it was weird.
Yeah.
But we did take the shot just for that same reason, because you know what? They got it. We've seen what it's done to them also.
I think it's a good choice. You made a good choice.
Yeah. I mean, look, when you're younger, then you could play the risk because you're in better health.
Yes.
The older you get, the more your health goes down the tubes.
Yes.
So you make that choice based on your age. I mean, I'll tell you, my youngest is 12 years old.
Yeah.
We're getting him vaccinated.
Okay.
He's to be vaccinated. Why? He has the asthma. He has,
yes.
So he's had pneumonia and stuff like that. So it's like, all right, get him vaccinated. We spoke to his doctor. His doctor said, yeah, I think you should.
Yes.
So the doctor agreed. We're like, okay, go for it. Bam. So he's getting vaccinated, and he's 12 years old.
Yes.
So
yes. So everybody has their reasons too, and that's what I was saying, because some people are completely isolated and they're just scared of the disease coming into their bodies, and but it hasn't affected any of their family members, or they are perfectly healthy. They don't have pneumonia, asthma, or anything, and they're just being scared and going to the hospital. And that's what I don't understand here. It's like, why are people getting so afraid? Because I think most of this is not actually a disease pandemic. I think it's the numbers are being exaggerated.
Yes, I think numbers were exaggerated. I could tell you that I had an aunt that passed away. Actually, my godmother passed away back in, I want to say August, September, more or less, of last year.
Yeah.
She died of cancer.
Yeah.
But they ruled it as a COVID death.
My deepest sympathies. This is wrong. This is so wrong.
Yes, it was very wrong. We were like, no, she didn't die of COVID. My godmother had cancer, and she chose to stop her treatment, to stop everything. She's like, look, I'm done fighting. And she passed away. But they put it as a COVID death, and she didn't die of COVID.
Yeah.
So are the numbers falsified?
Yeah.
Yeah, I think so.
Yes, even when I spoke with my friends, they told me that they wish they could have recorded the conversation, because they actually added a patient who died from diabetes as death from COVID-19. That's why I was arguing, but that's so wrong. Why can't you come forward and talk about it? But then they're afraid about their future, having a job in the public hospital, and
right.
Those sort of tensions arise. So I'm supposed to do this podcast actually with them, but they backed off after.
Well, because nobody wants to put their reputation on the line.
Yeah.
I mean, I could sit here and talk about it. I don't care. Why? Because number one, my job has nothing to do with medicine.
Yeah.
So I could sit here and talk about it. To me, it doesn't matter. I'm not worried about it.
Yes.
But when you have these medical professionals and their job depends on medicine, then more than likely they probably are not going to want to talk about it.
Yeah. So that's why I have at first I had about 5 friends who are willing to do the podcast with me. That's why I say a group of med students in this podcast. And then once I actually started, they were getting actually afraid of their careers. And I was like, no worries, I will continue without you. And one doctor came forward and she said that make sure I'm anonymous.
Well, yeah, that's the
Yeah.
way to do it. If you're gonna do it, you gotta be anonymous.
Yes. I
You
was like,
know,
at least you came forward.
right. Now, that's just the way it is. You know, but what do you call it? I lost my train of thought for a moment. I was trying to do two things at once. Yeah, so you're gonna have people that are gonna be like, no, don't show my face. Like I had on my show a couple of weeks ago, I had a guy I was talking about Colombia.
Yeah.
Okay, and all those stuff that was going on out there. And he's like, don't show my face. Why? Because he's in a sector of the public where he deals with the public on a constant basis. So his views go against a lot of the other views around. So
Yes.
he will talk, but don't show his face. I was like, okay, no problem. And that's the way people are. They put their reputation on the line, or they're gonna give you stories, but they don't want to put their reputation on the line.
Yeah.
It's
like that's what I figured at the end. I was like, no worries, I will still continue the podcast. And even if I still chose medicine, like I would choose to work alone if these type of stuff actually happen in the workplace. I would be like, I would still be my own self. I don't want to rely on the job sector. And that's just me. That's my personality. It's like if there's something wrong occurring, I would be the first to speak up. I feel like I'm the only person who's like